Of course. And you represent the Bronx, and it has been really hardly hit by COVID-19. Just starting this interview, I have to ask you, so one of the biggest questions right now that everyone has on their mind living in New York City is reopening. What is your personal take on it? And, what is needed for you to reopen the state currently?
Well, thank you. That's a very good question. I may differ with some of my colleagues. I tend to be a lot more careful and conservative than most other people. I think if you ask me that statewide, and I dare say throughout most of the country, especially those 18 states where you're seeing a rise in infections,
Right.
I don't think that we are really prepared to open up the state, certainly not the city. For me, we need a lot more testing done than we've seen already. We need more tracing done throughout the city. And we need a lot more, PPEs, and we need people to follow social distancing rules. Essentially, we've seen that breaking down throughout the country. I mean, not just New York State, but throughout the country.
Right.
Over the Memorial Day weekend, you saw evidence of people at beaches. Social distancing rules went out the window. You see families, especially with small children, without masks, without practicing social distancing, without wearing gloves. And I'm very concerned about that. If you ask me, if we continue on the trajectory that we are going the last couple of weeks, I think there's going to be a second wave. It's going to hurt us. It's going to hurt the economy more than it already has.
Right.
So what I've been telling people is please continue to take the necessary measures to stopping the spread of this virus, washing your hands, going out if only necessary. But some people are heeding the warning, many aren't, and I am extremely concerned about that.
Senator, we have lost so many, individuals to this disease, especially in the state of New York, in New York City. I would love for you to give a message out to all those that are grieving the loss of loved one. And also, what is the state doing to assist these families right now, especially in New York State?
Sure. I mean, first of all, around my circle, for lack of a better term, I've lost about 23 people.
Oh, wow.
Community activists, people that are like precinct councils and community boards, tenants associations. We had one TA president who was a friend who, a month and a half ago, we were together in a news story about still water, wasteful water in the back of a housing development. And they found him deceased in his home. He died alone without family. We saw the head of a precinct council, someone who didn't have any pre-existing conditions, who died suddenly. We saw a community leader in the Bangladeshi American community who passed away, who, he was one of the pillars of that area. So it's been terrible. And my heart, my condolences goes out to the families. It's so difficult to lose someone, especially when just a couple of months ago, this is something that was inconceivable. But it's part of everyday life now. The entire world has changed. And I don't see us going back to where we were before. But it's such a gut-wrenching experience to lose so many. And I really wish that, we can recover as a society, and any of those family members who've lost people. If they need my help, they can always reach out to my office. We're extremely helpful in any way. Now, on a legislative side or a policy side, one of the things that we did was we had HRA. We have legislation, myself and Assemblywoman Catalina Cruz from Jackson Heights, proposed legislation to increase the amount of monies that the city allows for funeral expenses. We increased it from $1,700 to $3,400. But one important element is that, in the area that Catalina represents in Jackson Heights, and certainly the area, there's a portion in my district, Starling Avenue, where we have a lot of undocumented immigrants.
Right.
People that are really essential workers that are at the forefront doing cleanings that no one else wants to do, putting their lives at risk. And because of their immigration status, they haven't had the dignity. Their families have not had the dignified burial for them because many of them just can't afford it. And since HRA doesn't permit undocumented immigrants to participate in this program, they were dying and the money wasn't there. So myself and Assemblywoman Cruz proposed legislation that increased the threshold amount that will be paid to help families cope with funeral expenses. but also to include undocumented immigrants. To some degree, HRA has done some of the things that we're proposing at the city level, but certainly want this to be statewide because so many people, especially immigrants and undocumented, are suffering and they don't have access to a lot of the safety nets that are being proposed throughout the state and the country.
Right, and directly related to that would be racial disparity and the impact of COVID-19, the economic crisis, the healthcare crisis on it. What do you have to say in terms of the racial disparity you've noticed personally in your district, as well as in the New York City itself? And when we're talking about these immigrant communities, how are we helping them right now? What are some of the resources they can, look out for to help themselves?
If there's something that this pandemic has highlighted or underscored, are the racial disparities that exist in our society, even in 2020. You'll see that in terms of economic stability, it is our communities, poor communities, Black and brown communities, that carry the load of many of these jobs. They can't afford to go and get on a plane to the Caribbean and stay there until this subsides. They have to work to support their families, and they're the ones that are at risk. We're talking about people that work in our subway systems, in our medical facilities, in our hospitals, people that clean our hospitals, people that have jobs that put them at risk. And so they have to maintain their jobs to survive. And yet, we haven't provided them with the kind of assistance that many of them need. If you look at the policing of social distance,
Right.
No matter how the commissioner tries to sanitize the numbers or tries to justify the numbers, something that he's tried to do time and again, the reality is there is a disparate treatment in our communities as opposed to white and wealthy communities. Until recently, a lot of the backlash, of course, led to a change in enforcing social distancing rules to the point where now the NYPD is leaving it to school safety officers and individuals that work with not-for-profits. But until recently, Black and brown men and women were arrested, were brutalized, as evidenced by that video a few weeks ago. Were brutalized by the NYPD, and not all. I mean, I don't want to paint all of them with the same brush, because the NYPD also are essential workers who are putting themselves at risk. But there was a significant amount of them that were treating our people differently. When you see the pictures of the West Village or Central Park, you had police officers giving out masks in those areas to people that were violating social distance rules. Yet in our communities, they were giving out arrest warrants. Fines and arresting people. And luckily there was enough backlash that subsided somewhat. It still exists to some degree, but it has subsided. If you look at health indicators, I represent probably the poorest senatorial district in New York State. In terms of health, we are dead last. We have diabetes issues. We have asthma issues with our children. And again, what this pandemic has done has really highlighted the differences in our health system in the Bronx, in the South and Central Bronx, as opposed to the rest of the state. You're seeing that we don't have adequate care, and that's reflected in the percentage of people that are passing and dying as a result of this virus. 34% Latino, 28% African American, and just in general, communities of colors are suffering the brunt of fatalities in New York State, which is the epicenter of this coronavirus. And so clearly, if anything that it has demonstrated is that we have to, as a state, put in an incredible amount of more resources to help the healthcare systems in these poor neighborhoods. We can no longer rely on employment-based healthcare, unemployment-based health insurance, I should say. We need some level of universal health care in our state, and I say in our country. Employment-based health insurance, as you can see, as individuals lost their jobs, they lost their health insurance.
Yes.
And that's a tragedy that shouldn't exist in our society, one of the wealthiest countries in the world. So we're going to have to rethink and relook at our healthcare system, make it fairer, make it more accessible to poor and Black and brown communities. If not, whenever you have these type of pandemics, you're going to see that it's our people that suffer the brunt of fatalities.
What is the condition of the healthcare system currently as we speak in terms of PPE, in terms of hospital capacity? Are we ready if there is a resurge of COVID-19 cases? And also in terms of just the future of healthcare as you reflected upon, what is really needed out of the system right now to really cater to these communities that are not getting the help they need?
Well, in terms of PPEs now, if we're not better prepared for what I believe is a second wave, then we will never be better prepared.
Hmm.
Uh, the problem is we still don't have enough testing. The problem is that, and I hope I'm not offending anyone, but I think we have probably the most incompetent president that we could have had during this crisis, who has engaged in more denial than in action. I mean, when you don't have enough swabs to do testing, and we are in one of the wealthiest countries in the world, then it just baffles the mind that we have this issue. We still don't have sufficient PPEs. You still have hospital workers and essential workers who do not feel safe, who have to use their PPEs more than once. So we have to make sure that we have the chains of production, or the chains of purchasing these types of PPEs better than we do. And that has to happen at the federal level. And until the president decides that saving lives and taking care of people is more important than the economy, we're still going to have this issue. But at least the governors are better prepared to tackle it, are better prepared to get more testing. They're not fully prepared,
Right.
but they're better prepared. So, we still have to work on that. We still have to invest a lot more money in poverty programs, because healthcare is not just the actual medical attention.
Right.
You're talking about pollution. You're talking about racial pollution. You look at these sites where there's a high level of pollution and waste centers. They are in our communities. Look, I proposed a bill that has brought some concern to some religious communities, that will limit or actually close down the poultry live markets, or the live markets in the city of New York. We have 80. You never see those markets in wealthy neighborhoods. Now, those markets are breeding ground for genetic viruses. There have been outbreaks before. They were contained, but there were outbreaks. They for avian flu viruses in some of these live markets that existed in Brooklyn, and that's why we limit the number of licenses. But you never see these live markets in wealthy communities. You only see them in poor communities. And so they are around schools. They are in areas that have concentration of populations. They are, there's no reason why we can't get another type of coronavirus like we have that's killed 100,000 people, why that can be a pandemic that starts right there in those communities. And so when you have poverty, when you have communities of color, our state agencies tend to ignore them. They don't invest the amount of money that they should. Same thing with education. So it's a recipe that has existed that leads to things like obesity, diabetes, asthma. Our children in the Bronx have a higher rate of asthma than any other place in the world. That's the waste sites, that's the highways, that's the Cross Bronx Expressway. Until we invest sufficient amount of monies, until we do things to mitigate these factors, jobs, education, even healthy eating. We have food deserts in the Bronx. People, if you look at the school systems until recently, you see the school lunches that are provided. There's very little concern about proper eating, and very little concern about providing good food. I mean, we have the Hunts Point Produce Market, which is essentially the bread basket of the eastern area of the country, of the East Coast. And yet, we look at the food qualities in many of these bodegas and many of the areas that provide food to these communities, and they are at best poor. And so until we come up with a comprehensive program that includes proper education, health, mitigation of pollution, industrial waste, we're not going to see the kinds of things that we should see in terms of improvement of healthcare. We do that, we'll have a healthier Bronx, and that's something that I will not rest until we get it done.
Senator, what do you have to say about the issue of food insecurity? Your office has been trying to promote as many resources as possible for it. I would love for you to discuss that and also provide those resources for all the viewers in case they need help and they're in the area.
Well, clearly when this pandemic hit, we knew right away that, for example, our NYCHA developments, our public housing developments,
Right.
Where there is such a high level of poverty and seniors and illnesses, we knew immediately that there was going to be a high level of food insecurity in these areas. But we've also seen in areas that traditionally you don't see these issues have also arisen. People would have to decide whether to pay certain expenses or eat. People have to decide whether to buy their insulin or pay their rent or buy food. So what we did is that we worked with several organizations, for example, the World Central Kitchen, Fresh Direct, which has a plant, for lack of a better term, in my district in Hunts Point. We work with restaurants. We work with the City of New York with pantries. We work through community-based organizations. I had a town hall a couple of days ago where we discussed food insecurity with city agencies. I know the city has stepped up considerably. Most public schools have grab-and-go meals. There were some concerns about the quality of some of these grab-and-go meals, but that to some degree has helped. There were some concerns about the specific diets like halal foods. That to some degree has been resolved.
Right.
Our senior centers have also have provided grab-and-go meals. And one thing that I keep telling everyone is that if anybody needs help, I don't care if they live in my senatorial district. If you are hungry, you can call my office. Our number is 718-991-3161, or you can email us at team@senatorsepulveda.com. I don't care where you live. If you are hungry, I will be there. My staff will be there to provide you food. I would never want anyone to go hungry. For me, it's heartbreaking for a child or a senior to go to bed on an empty stomach. You can also call 311. The city has a lot of resources available. The state has resources available. Every day I work, when I wake up, I'm making calls immediately to for-profit and not-for-profit entities trying to secure food for our communities. And I'm very proud of some of these organizations. I'm very happy with some of these organizations that have stepped up to the plate and said, we're going to help, and many of them have. And as a result, there've been billions and billions of meals served throughout the state because people have really stepped up.
Definitely. Another issue that really concerns the community, Senator, is obviously a lot of these small businesses that are really taking the hit of COVID-19. The businesses that have been completely shut, the businesses that are still not opening. A lot of South Asians and Indo-Caribbean community members, they own these businesses across the state of New York, and especially in your district. What should they know about these economic ramifications, and how should they be seeking help in order to survive right now?
Well, one thing is that there was some federal dollars and state and city dollars allocated for loans, for payroll to these small businesses. One of the things that we've seen is that many of our small businesses, which again is the highest employer in this country, small businesses employ more people than even big corporations.
Right.
But what we've seen is that many of them didn't keep correct accounting records. Many of them didn't pay taxes. Many of them had employees off the books. And this is a result. This results in them not being able to adequately demonstrate through records the existence of their business. And so now some of these programs that can help them, because they don't have the financial records to establish how they've been running their business, they are at a disadvantage. So what I implore our small businesses in our communities and all communities is to make sure that you keep adequate records, because that's the way you can benefit from some of these programs. Right. There are loans out there. Initially, it was problematic. It was like going through jump ropes in order to access these loans. But the city had loans, the state has. And again, if you need assistance with that, I urge you all to call my office and we'll be there to help.
Senator, what are some of your biggest concerns for this week and the next few weeks when the state is going through its phased reopening? Certain businesses will open up, certain areas will open up. What are you focused on during that time period?
Well, again, I think people, I don't know, it's because social distancing is very difficult for a prolonged period of time.
Right.
But I believe that people are not really heeding the warning about how infectious this disease is, and B, how fatal it can be. you see time and again wearing a mask has somehow become a political statement.
Right.
So I see people at a beach, saying, you have to die of something, or you can't live in fear. But okay, you don't want to live in fear, then stay home and live in fear not live in fear by yourself. But you're putting a senior at risk. You're putting a child at risk. And so this level of selfishness, to some degree, is going to lead to deaths. When you see a president who doesn't wear a mask, it's sending a wrong statement. You see time and again people through social media saying, well, if he doesn't wear a mask, then that means that I don't have to be worried about getting this disease. It sends the wrong message. And the infectiousness of this disease is people say, well, people die of the flu.
Yeah.
This is 10 times more, excuse me, this is 10 times more infectious than the flu, and a lot more, and a lot deadlier than the flu. The level of how contagious the coronavirus is something that people are not respecting. You touch an elevator button, and if you're infected, you touch an elevator button. The next person that touches that button, if they're not wearing gloves or they don't wash their hands, they're going to get it. And when they go home, they will touch the refrigerator door, and their children may touch it. And now we're seeing a peak in something called Kawasaki type disease,
Right.
which is some level of inflammation in the lungs of children. I think 3 or 4 children have died. We can't take a chance with our children. We can't take that chance. And so people are not practicing some of the simple measures that are necessary to spread the virus. People are still going out there, going to stores and not wearing masks. And, they don't want to wear it, but it's really about protecting other people, protecting our seniors and our children. And I am concerned that people are becoming too lax about it, and people are too concerned about the economy. Look, I know it's very difficult. People have to pay bills. But sometimes when you have to make a choice between the economy and life, I will choose life 110 times out of 110 times.
Definitely. I think I would also choose life out of, 100 times here too. Thank you so much for your time here on ITV Go, Senator. I really, truly appreciate you for sitting down here. I would love for you to give one last message to our audience, but I also would like to thank you for your time and all the efforts your office is doing in order to ensure that New Yorkers stay safe.
Yeah, I have to look. I have to give credit to some of my partners in government. Assemblyman Michael Blake, some of my my locally elected officials like Chantel Jackson and Marita Torres, Latina Brown, Amadeus Alonso, Amanda Farias, Ramon Cabral. These are people that on a daily basis we have a conversation, and it's like us meeting as a troop and deciding where we're going to go. And of course, a lot of credit goes to my staff. They are an incredible group of men and women who have stepped up to the plate in a way that, I'm so proud of them and so thankful to them, because they certainly have helped this community in so many different ways. And just to our essential workers, our frontline workers, our seniors, our healthcare workers, all these individuals deserve so much credit. Next time you see one at a distance, give them a hug and thank them, because they have made life easier for many people, and I dare say they have saved many lives. So, and I want to thank you for having me in the program so that we can deliver this message of hope, but of caution for your viewers and for the people in my district in the state of New York.